Hello and welcome to Conversations Lectures. My name is Fatih Krakis and I'm the Head of Training at All Graduates Interpreting and Translating Services. Before we start, I'd like to respectfully acknowledge that we are presenting today's lecture on the traditional land of the Wurundjeri people of the Kulin Nation, and I pay my respects to the elders both past and present. Now, a bit about Conversations Lectures. Conversations Lectures is an international talk series hosted by the All Graduates Training Division, Conversations Interpreting and Translating. The series invites translation and interpreting academics, students and other practitioners, translation and interpreting technology companies, and researchers and professionals who work in the culturally and linguistically diverse services sector to discuss their research and works. I'd like to welcome all our guests in the audience. Hello, welcome. At our training facilities here in Melbourne, as well as everyone online in Australia and around the globe via our YouTube channel. And those of you that are on the YouTube channel now, please don't forget to like and subscribe for updates. Thank you. Today's lecture is titled The Mindset Study, Improving Interpreting for Dementia Assessments, and will be presented by Professor BIANCA BRIJNATH and Dr. Andrew Simon Gilbert. Now, a little bit about the project. The Mindset Project is a partnership between researchers and stakeholders in the interpreting and healthcare sectors to upskill interpreters via an online training course in dementia and cognitive assessments. The training has been co-designed with key stakeholders and aims to improve the quality of interpreter-mediated communication during a cognitive assessment, and thereby improve the accuracy and acceptability of cognitive assessments with older people from non-English speaking backgrounds. It is the first time a training resource for interpreters in dementia has been trialled. This presentation will provide an overview of the Mindset Project and invite interpreters to join the study. All Graduates Interpreting and Translating Services are proud to be one of the sponsors for this very important study. We would also like to extend our gratitude to all of the other sponsors, which include NHMRC Partnership Projects 2020, NATI, the National Accreditation Authority for Translators and Interpreters, AUSIT, the Australian Institute of Interpreters and Translators, Dementia Australia, Migrant and Refugee Health Partnership, TIS National, Translating and Interpreting Services National, Healthcare Interpreter Service New South Wales, Televic, and Commonwealth Department of Health and Aged Care. Now, a little bit about our presenters. Professor BIANCA is the Divisional Director of Social Gerontology at the National Ageing Research Institute, might also know it as NARI. Her disciplinary training is in medical anthropology and public health, and her research expertise is in cultural diversity, dementia, and mental health. She has authored over 100 publications, including a sole-authored book with Bergan Books titled Unforgotten: Love and the Culture of Dementia Care in India, and is the lead investigator for the Moving Picture Study in Australia and in India. Dr. Andrew Simon Gilbert is a research fellow in the Social Gerontology Division at NARI. His disciplinary background is in sociology, communication studies, ageing and qualitative research. He's an emerging researcher in health and aged care systems, including organisational issues and policy. In 2020, Andrew led a project investigating integrated models of care, health and housing on behalf of the Royal Commission into Aged Care, Quality and Safety. First of all, please welcome Professor to start us off, and then she will introduce Andrew for the second part. Please put your hands together for Professor BRIJNATH.
Great, thanks Fatih. It's a very kind introduction. I think interpreters are for a large part a hidden workforce. So much of what all of you do is almost unconscious in terms of what happens in facilitating communication. And so as a result, you rarely get seen in the healthcare system, because if you do your job well, you're rendered invisible in some respects. But as we all know, Australia is an aging and a multicultural country, and we no longer can afford for interpreters to be hidden or invisible. We really need to recognize their talents and skills and help improve and build capacity. This is partially also because as an aging nation, dementia is associated with aging, and there will be an anticipated increase in the number of people who live with dementia. Now, one of the things we know also about dementia is a characteristic of it is that you have aphasia, right? Which is loss of language. And the general rule is last in, first out. So if English is your second, third, fourth, fifth language, you will forget that first before you're going to forget your mother tongue or the language you initially learned as a child. As an interpreter, if you don't have a good understanding of what dementia is, of the symptoms associated with it, of how to navigate that particular world, it can be very challenging. You can make mistakes, and I'll talk about that in a little bit, right? So as a result, I think what happens, but at the same time, interpreters, you've got that challenge if you can make mistakes. At the same time, you're not trained to facilitate a cognitive assessment. You're not trained about what dementia is. You're not necessarily informed about what those symptoms might include. That's not your fault. You're an interpreter. You're not a ACAS clinician. You're not a nurse. You're not a speech pathologist or any of those other things. So it's fine for you not to know. But the problem is if you have a limited understanding of the condition, then, and you've got varying levels of training in terms of how to actually do a cognitive assessment, there is a very big margin for error, and that can be very problematic. The other thing to also remember when we're doing an ACAS assessment or when you're doing a cognitive assessment for dementia is that you might be asked sometimes to interpret and various cognitive tools and assessments that are applied. Again, if you're not familiar with these cognitive tools, if you're not familiar with why the questions are asked the way they're asked, if you're not informed about the kind of intonation that you need to be aware of, if you're not informed about the kind of disordered speech that the clinician may be looking for, then it's very challenging again to do an effective job. So what tends to sometimes happen to all of us, not just to interpreters, to all of us, when we don't have a good understanding of an area, we tend to fall back on what is culturally familiar and what we think we know about a topic area. Now, dementia is one of those topic areas where we might have a kind of language or a nomenclature for it in our own languages, but those might be a bit problematic sometimes. Let me give you an example. These are some of the words that are used to describe dementia in Mandarin. I will not attempt to pronounce them in Mandarin, but if we have people in the audience who'd like to give it a go, that would be great. But as you can see, some of these words, I know some of them are colloquial and some of them are formal, but all of them in some way, shape, or form can also be quite pejorative. They can be a bit challenging to deal with, right? And so that can really create a lot of consternation if you don't use the right word, or if you fall back on what you think is familiar, but actually becomes, can really set things off in a assessment. So imagine, well, in this case, don't imagine, this is your life, right? You are all interpreters, right? It's 11:15 in the morning. You've driven across the city. All graduates have sent you off to an appointment. You've got this notification on your phone that says, go to the Royal Melbourne Hospital, to the Royal Park campus, go to building 4, and go to room 3. You've got to do an interpreting there. And you think, okay, all right, I've got the details. I know where to go. I know when to go. Off I am. But you don't necessarily know the information and what you're going to walk into and find, right? Quite often interpreters will arrive at appointments and they'll find, in this instance, maybe you'll find a doctor and an older patient are already there waiting for you in the room, right? And the doctor doesn't brief you or tell you anything. The doctor might just say to you, look, I want you to translate into Mandarin that the aim of today's discussion is to assess for dementia, right? And if you don't know a lot about dementia, you might think, well, what the hell is dementia? How do I describe that to this older patient? Maybe you'll use one of those words to describe it, right? And then perhaps the patient might think, well, hang on, you're telling me I'm here to be assessed for an elderly retardation disease? You can imagine that the patient's going to get quite upset about that. That's going to derail some of the assessment. Maybe later on in the assessment, the patient might be asked to read an instruction, but their speech is disordered, and you're not sure what to tell the doctor. You know, how do you translate this? You ask them to recall or name all the animals they could think of, but then they couldn't name the animals. They sort of waffled on. Their speech was mumbled. How do you communicate that to the doctor? Right? And the doctor's getting irritated with you, going, well, why can't you just tell me what they said? And you get upset, and your heart sinks, and you think, oh, now what am I going to do? You know, how do I manage this problem? We suspect, based on our past research and based on the enthusiasm of our partners, that the scenario that I have described to you is not uncommon, that all of you might have experienced this at some point or the other in your professional lives. And therefore, what we're trying to do with this particular project is to establish specialist online training for dementia for interpreters in an effort to improve cognitive assessment for dementia for people from a culturally and linguistically diverse background. Right? So that's the aim of this work. As I said, we know dementia can affect communication and language. Aphasia is a very common symptom of dementia. At the same time, as people start losing their language, so even though they might have spoken English very well, with dementia that might start to unravel. And clinical guidelines from the National Health and Medical Research Council, as well as from the MyHK guidelines, they recommend that interpreters are used when you're doing a cognitive assessment for people from a culturally and linguistically diverse background where English proficiency is not entirely clear. The guidelines recommend that we do use interpreters when we're doing cognitive assessments. About 40,000 ACAS assessments are done every year with people from a COLD background. Right? And we know that these assessments will be very challenging for interpreters, and that there is no specific training for interpreters. So very often, some of you might have availed of training from Dementia Australia, some of you might have gone online and read something, maybe you did a MOOC. You've upskilled yourselves in different ways and shapes and forms. But none of that training is really specifically designed to address your professional needs. And that's where we come in. That's what we want to fix. So this is, as I said, it's a national study. It's funded by the National Health and Medical Research Council. There are various members involved in the project, so I just wanted to acknowledge some of them up there. I won't go through the entire list because Fatih has already mentioned them all, so I won't reiterate that. I also want to acknowledge that this work, Andrew and I are here today, but we're not the whole and soul team. There is a much larger team behind us of people from across the country. And they represent a mix of different disciplines and talents. So yes, I'm an anthropologist and I have expertise in working with multicultural communities. Andrew is a sociologist and has a lot of expertise working with interpreters. But Dina, for example, is a geriatrician and often does cognitive assessments. Erica is an interpreter, as is Jim, and they teach interpreting studies at their various universities. Robin specializes in medical education. Joanne Anticott's a biostatistician. Antinadis also works with us and has expertise in COLD communities and dementia, as does Lee Fei Lo. And then we also have some associate investigators who've been part of our work over the years and informed some of the things that we're doing. So to give you a quick overview of this study, what we did is we co-designed it. It sort of comprises 3 phases. The first was a co-design, where we worked very closely with interpreters, clinicians, and family carers of people with dementia who are from a COLD background. So we brought them all together in 2 workshops where we worked with them to ask, well, what should be included in the training, and how should it look? The interesting thing about what should be included in the training, how should it look, also made us reflect on the assessment. So how would we assess the interpreting training that we delivered if it was effective? And so part of that assessment is a simulation that we're doing, that's an online simulation, and Andrew will talk you through that in a little bit. But the simulation is really interesting because they're based on these scripts that interpreters participate in, right? And the scripts were also co-written with all of these stakeholders that I mentioned. So they have informed every single step of the journey, which is quite important. Once we developed the training, we then user tested it with several interpreters to make sure it actually does what it's supposed to do, and that it's easy for you all to navigate when you go online, and you can kind of work through the system quite intuitively. The next phase of the study is really the evaluation, and that's where we've entered into now, and that's the trial. And we're looking for 120 interpreters. Everybody gets the training. That's the most important part to know. Everybody gets the training. It's a matter of when you get the training. Okay, so if you're, because it's an experiment, and you have an intervention in a control group, so if you're in the intervention group, you get the training straight away. If you're in the control group, you get the training in about 6 months, but everybody gets it. So no, don't worry that you're going to miss out. You're not going to miss out. And then after that, once we finish our trial, we then go to an implementation phase where we would like to make the training available to all interpreters in Victoria. And then we will actually interview interpreters, clinicians, and managers of interpreting agencies, such as all graduates, about whether that's made a difference in their practice, and if interpreters are indeed doing an overall a better job in the system. And we sincerely hope they are. So this is just another way of presenting our study, and how we hope it will unfold. I'm now going to hand over to my colleague Andrew to give you a bit more detail about the training itself and what's actually included and how it looks. And I sincerely hope that gives you a deeper understanding of what the training involves, and it motivates you to take part in our study. So over to you, Andrew.
Thank you, Bianca. So, in this training, we thought it was important to sort of cover several different things. First, it's important to introduce interpreters to dementia and the various different types of dementia, what can cause dementia, and also how dementia can be prevented, in order to give, I guess, interpreters an understanding of what the disease is that a person might have when they present with dementia, and also perhaps what they're going through. We also thought it was important to look at culture and how culture might affect the way people interpret dementia symptoms, the way people might define dementia, and how that also might affect how they seek help, how culture might, affect the way the preparedness of people to engage in health and aged care services, and things like stigma around dementia in some communities. But of course, we also wanted our training to be very practical. So interpreters who take the training will get very practical guidance, very practical tips on what they should do if they go and interpret an assessment. So part of this, there's a large emphasis on briefings and introductions and debriefings. Part of our research team, who are interpreter trainers by profession, thought that this is an extremely important part of interpreting, especially when dealing with situations like this, where an interpreter really needs to be well informed about the cognitive assessment, first of all, but the potential communication challenges that might arise during the interaction, so that they have, that they're ready to sort of manage that. So part of that is having an effective briefing. Another part is obviously introductions, like interpreters need to introduce themselves in a way that is clear to the client, and if a client is cognitively impaired, then perhaps they haven't really worked with interpreters much before. So this is a moment when it's very important that they feel comfortable and they feel they understand what's going on within the interaction. Then a large part of the training concerns interpreting itself, and particularly because dementia is a cognitive condition, and because the symptoms are so wrapped up in the way people communicate the things they say, and also the way they're assessed it's a linguistic test, right? It's all verbal. This means that the onus really is on the interpreter to make sure that it's interpreted as accurately as possible. And that's not just about the words, it's also things like hesitations, ums, ahs, repetitions, things like this. These can all be symptoms of cognitive impairment, and this level of detail of interpreting might not be something that every interpreter's used to. It's not every situation doesn't require that level of accuracy, but we believe in cognitive assessments it does. So there's quite a bit of the training concerns that. And finally, the code of ethics. We thought it was quite important to consult the AUSIT Code of Ethics, and we provide, I guess, kind of practical examples of where the AUSIT Code of Ethics might be a challenge, and sort of situations that might be ethically challenging for interpreters regarding their ethics, and also how they would respond in such situations. The training's about 4 hours long. That's a pretty good length, actually, because what that means is that if you take this training, you qualify for 20 points from NATI, PDR points that you use for recertification. And it's really important, we thought, that it was all accessible online. So we've teamed up with Televic, who are a education provider, and we've put this all on their online system. And it's self-paced, it's pre-recorded, so there's no lectures you need to get to at a certain time. You just do it when you can access it. And this is, I think, quite important for the interpreting workforce because, they're working throughout the day, and making classes can be quite challenging. So this is what assessment queue looks like. I'll go a bit more into this, but when you log in, this is the training itself, the sort of information across here, and we have the navigation panel here, which makes it easy for interpreters to navigate. Part of developing this training, we filmed videos. We wanted to film videos which showed, I guess, good practice of interpreters in their kind of conduct when undertaking interpreting a cognitive assessment. So we made this film. We did this at our office in Nari. It's in Greek, mainly because this actor who we found, he was an excellent actor and was able to convey the experience of an older person who was perhaps cognitively impaired very sensitively and very convincingly. So we shot this film. This covers more or less the full process of a cognitive assessment from the briefing outside, through the introductions, through the questions, and then to a debriefing. Again, this is a screenshot from, and I think I can play this actually.
Mr. Puppets, do you recall that shopping list we discussed when we first started?
Κύριε Πάπα, θυμόσαστε τη λίστα με τα ψώνια που είχαμε συζητήσει όταν πρώτα αρχίσαμε? Τι λέει αυτή εδώ? What did she say?
Earlier, I told you to imagine that we were going shopping. Do you remember that?
Προηγουμένως σας είπε να φανταστείτε ότι πηγαίνουμε στα μαγαζιά. Το θυμόσατε αυτό?
Το μεταφράζει καλά αυτό. Δεν ξέρω περί τίνος πρόκειται εδώ.
Προηγουμένως, σας είπα να φανταστείτε ότι πηγαίνουμε για ψώνια. Το θυμόσαστε? Και ναι, μεταφράζω σωστά. Mr. Pappas asked me, are you translating this correctly? I don't know what this is about. I repeated your question and also confirmed that I am interpreting you correctly.
We imagined that you and I were going shopping together. We made a list. Do you recall?
Είχαμε φανταστεί ότι πηγαίνουμε για ψώνια. Είχαμε κάνει μια λίστα. Το θυμόσαστε?
Τι σημαίνει με αυτήν εδώ, προσπαθεί να με μπερδέψει. Θέλω να σταματήσω.
What's wrong with her? She's trying to confuse me. Oh, I want to stop.
Έχω πόλικο φαγητό. Απ' όλα έχω.
I have enough food. I have...
Food. Μ' αρέσει το food, αλλά έχω απ' όλα.
I like food, but I have enough food.
Κοίτα εδώ. Πορτοκάλια, μανταρίνια.
Say lemons, oranges, mangoes. I have all of these.
It's fine, Mr. Pappas. We can stop now.
Εντάξει κύριε Παπά, μπορούμε να σταματήσουμε τώρα.
Ευχαριστώ, να σταματήσουμε.
Yes, thank you. Stop. Please stop.
So that's part of the training, and that's kind of the meat of what we're doing. But as Bianca said earlier, we're putting this training to trial, and really what we're interested in the trial is we're not assessing interpreters per se, we're interested in assessing the training and whether it's effective in helping interpreters communicate more clearly, more accurately during cognitive assessments. So in order to do that, we had to develop an assessment, which is also online as part of the trial, and this covers 5 domains, the same 5 domains that are addressed in the training. Most of this is done through multiple choice questions, such as the components about background knowledge about dementia, culture. There's a part about debriefings and briefings, which is sort of multiple choice. But for the actual assessment of interpreters themselves, we've used a video simulation, and it's the first time a video simulation like this has been put on an online platform. I believe that you've been able to do this through software on a computer in the past, but this is the first time it's been online, and so that it's really, in a way, we're guinea pigs for this new software. It was released right during the development of our trial in March this year, so it's very new. And we're still kind of getting used to it. But I want to show you the platform now. So first I'll just show you the training. So when interpreters access this, they get given a code by me, and then they access it through this interface. As it says, I've gone through 8% of the training. And this is what the training looks like. So it's broken up into 5 different modules, which you can see down here, and you can navigate quite easily to any part of the training. And we sort of encourage people to go backwards and forwards because we've embedded some questions within this training that I guess challenges your knowledge about dementia and the topic, and we encourage interpreters to, after taking those questions, go back to the parts that they'd done earlier and sort of refresh their memories. I won't show you obviously the whole thing because it takes 4 hours, but for example, we have components on dementia myths, how dementia affects communication, and so on. And this is all through our assessment platform, our learning platform assessment queue. So separately to this, we also have the assessment. And the assessment has 5 modules, and you take these in order. It's much more linear than the training. You're not allowed to sort of go back and And I've already worked through the first 3 modules of the assessment. It's multiple choice, so it's fairly straightforward. But I want to show you quickly how the simulation works, because this is the sort of interesting part, I think. So, very important, allow the website to use your webcam and microphone. And as you can see, there's the webcam comes up here. What I'll do is I'll go to the next part. This is the assessment proper. And what you can see here is there's 2 panes. On the left, we see the doctor. This is a pre-recording of a dementia assessment, a RUDAS assessment, which is a common assessment tool, which is designed for multicultural situations. And on the right is the webcam, so this is the interpreter. And under it we see 2 audio bars. The top is the pre-recorded audio, and there's these sort of pink tabs. These pink tabs are breakpoints where the doctor will say some dialogue, or it might be the older person, and it'll stop at those breakpoints and prompt the interpreter to interpret what was just said, and that will appear down the bottom. So I'll just show you how it works. So we click New Attempt.
Hello, thank you very much for meeting with me today.
Hello, thank you very much for meeting with me today.
My name is Dina and I'm a doctor. I'm going to ask you some questions about your thinking and memory.
My name's Dina, I'm a doctor, etc.
We also have an interpreter with us. They'll be translating what I say into your language and what you say into English. They will introduce themselves now.
We also have an interpreter with us, etc. Okay, I'll finish that there. And so once the interpreter's done the full thing, it uploads that section of the test up onto the cloud, and then they move on to the next question in the assessment, which is there. And then these are stored in the online system, and we have our partners at RMIT who are, experts at grading, interpreting assessments, will access these and grade them. So the way we're grading this is we've used the NAATI consecutive interpreting rubric, which is part of the certified interpreter assessment. I think it's a 6-domain assessment. Not all of it is applicable to pre-recorded video, because some of it deals with interaction management and much more contextual stuff. It's a bit unfair to assess people on that when it's a pre-recorded video. So it's assessed on four of those domains. And we're really looking at accuracy of interpreting, whether the interpreter's adopting the right I can't remember the technical term, but the right tone, whether the register, thanks Vati, the register, whether they're expressing the kind of emotions that the clinician is in a way that supports the whole assessment, and also whether they're conveying, because obviously we filmed an interaction where the older person makes language mistakes, they hesitate, they and they are, whether that is conveyed too. So as I said, we've used Televic's Assessment Cube platform. This is familiar to a lot of interpreters. I think that some NAATI assessments are already conducted through Televic products, and I know Monash University in their interpreting department have used Televic products. And the assessment rubrics have been designed by and for interpreters in Australia. They're the NAATI standards. As I said, people who participate in our trial will be eligible for CPD points. It's 20 points for completing the training, and on top of that, there's 10 points available for completing the assessments. You have to complete 3 assessments during the course of the training, because we're interested in how you performed before you took the training, how you performed after taking the training, and then in another 3 months' time, whether there's been still a flow-on effect. And we're also recruiting a control group who won't take the training until after their last assessment. And so we really need to do this because we need to compare whether taking the training has a strong effect on those interpreters who did it versus those who don't take the training but still take the assessment. We're currently recruiting for this trial. So we've been putting ads through AUSIT, through all graduates, through NAATI. Some of you have probably seen our calls for expressions of interest through your emails and etc. We're very interested in anyone who wants to participate. There's this. I'll just explain some details about the trial. As I said, it's a randomised control trial with 2 groups, a control group and a training group, with 3 assessments. Now, because we had to film the assessments in the video simulated assessments, we could only do it with so many languages. So we chose the 6 most common languages, we think: Arabic, Cantonese, Greek, Italian, Mandarin, and Vietnamese. So if you're an interpreter of one of those languages and you have more than 6 months experience and you're certified or certified provisional with NAATI, and you're happy to be recorded, then you're eligible for our trial and we're looking for your participation. If you're not one of those languages or one of those other conditions, don't worry too much. Once we finish the trial, we're going to implement this study more broadly, and then because we're no longer trialling it, we're just making it available, we won't be running the assessment. So the language constraints won't be there. People from any language will, during the implementation phase, be able to take the training. The training itself is in English, so it's been designed to be accessible to interpreters more broadly, regardless of their language. So if you are interested in participating in this trial, this is the website, www.nari.net.au/mindset. If you go to that website, you'll see a registration form. This has eligibility questions on it that you have to fill out. If you're not eligible, it basically won't let you sign up. If you are, you'll put in your information and that'll come to me and then I'll contact you. And if you just want to contact me to ask questions, if there's something that's concerning you or you just want to know more, this is the email, mindset@nari.edu.au. Something else that this is a bit of an aside, one thing that's arisen during our research, particularly during the co-design phase, is that a lot of both interpreters and clinicians thought that training up interpreters is only one half of the story. The other issue is that a lot of clinicians out there don't necessarily know how to work with interpreters very well or very constructively. And so one thing we're considering or we're planning down the track is to broaden the training to mindset clinicians. And this will be about training clinicians up in how to work constructively with an interpreter to help best support an older person undertaking cognitive assessment. But that's down the track. So yeah, thank you, and it's time for questions.
Thank you for the presentation, and a great initiative and much needed. We still have clinicians who give the unreconstructed mini mentals to patients, and they don't use RUDAS. They use what came out in 1953, and that still creates problems. And there are certainly those clinicians who aren't aware of those issues. So I think that phase is just as important as training the interpreters. Now you mentioned using RUDAS. What also I've seen in the aged care sector is a lot of people using a lot of other tools to assess things, including cognitive ability, but not only. There are stuff like that. A lot of it comes through site translations, one of the important things there is that the interpreter always has to see the instrument before they start the interpreting. It's such an important part of the briefing so that they know what's to come, as well as understanding what they've got to convey, because we have this in speech therapy too, that the style of speech is sometimes as important as the propositions that the person is putting. So I don't know if RUDAS is the only thing you're going to be using here, or whether there's other tools as well.
So we use predominantly the RUDAS for this cognitive assessment, and we've picked the RUDAS because it's culture fair, whereas several of the other ones, as you correctly point out, are not. And because we're honing in specifically on dementia, we've just left it at that. Otherwise, we're a bit concerned the training might blow out to many, many more hours.
Yeah, as Bianca said, we focus on the RUDAS, but we do mention within the training that there are other assessments out there, and we've provided links to them. So if interpreters want to go and investigate them, some of them are translated, some of them aren't. Also, we sort of make a point of saying, at the end of the day, the assessment tool is the clinician's decision. And, you know, if an interpreter has to interpret a tool that's not very suited to their language and not culture fair, then they can sort of voice that concern, but ultimately it's their job to do that. But yeah, I agree with you what you said about aged care assessments. Particularly, it's not just a cognitive test. They are walking around people's houses, seeing how they live, doing things like that. I've done qualitative research with clinicians and interpreters who do this. It's sort of touched on in our training, but yeah, the focus is definitely on cognitive assessments. But I think the skills are translatable. I mean, yeah.
Any other questions? Ren? You good? All right. Well, thank you very much. And thank you to everyone who has been watching from the live YouTube stream as well. And I think just well done on this amazing study. Looking forward to it. Unfortunately, Turkish isn't on there because I've got connections, you know. But yes, so if you are one of those languages, get onto the website, go through the selection criteria, the eligibility.
Yeah, it's just like a survey. You just fill it out. It's very easy to do.
Yeah.
How many do we need?
120.
120. Get in nice and early. It's limited. I know there are about more than 13,000 NAATI certified and recognised interpreters in Australia. And I don't know exactly how many of those are for those languages, but it's only 120 spots for probably a few thousand interpreters. So get in there, first in, best dressed. Yep.
First in, best dressed.
If you speak Greek or Vietnamese, then we're very interested because those are the groups we need at the moment. But the others too, but definitely.
No, you're just being picky.
Yeah, we're not going to be so picky. I just also want to reiterate the carrot, which is all the CPD points.
The CPD points, yes. So, and it's free.
Yes.
It's free, yeah.
So you've got CPD points, 20 points because it is 4 hours.
Yep.
The UNATI. And it's designed that way to get 20 points. Yep. And then you get 10 more PD points.
For participating in a research activity.
In the research activity, so 30 all up. That's quite a lot of points from the one study. So, and having said that, you're also being a part of this amazing study as well. Ren?
Which category of PD points they go?
Which category do you know?
I do, but I can't tell you the numbers right off. The 4 hour one is participating in a, I can't tell you the exact 2 point whatever, but participating in a training activity of at least 4 hours. You can also, because there's an ethics component, you can also choose to select, because I know there's an ethics subcategory in the PD kind of schedule. You can select to do that, but you can't use both, obviously. You can choose one or the other. The research the 10 points is participating in an interpreting research activity. Can't remember the number of that, but it's in the schedule.
It's in the schedule. Yeah. So have a look. It's in the NAATI PD category, and
it's in the consent form and information form. That the categories are actually explained in that. If you sign up, you'll see that there. Yeah.
So to find out the categories, sign up. And NAATI's quite flexible with that as well anyway, but you've got those on there.
They're in the consent form.
All right, Magda. And how you been going with the interpreter training platform yourself?
I think
you've been enjoying it?
Well, one thing I'll say is it's very good for education. So it's good for the students, but it's not designed for research. So I'm having to kind of be very flexible in that respect. But in terms of the students, I mean, and we did user testing. So we had 12 interpreters who sat down and did it, and I watched them do the assessment, and they found it very easy to use. Like it's very student friendly, I think. Yeah.
Very good. And because it's online as well, I've also seen it for the first time that you can practice interpreting with an online platform.
Yep.
And it gets recorded, and you get feedback on it afterwards too.
Yep.
Yep. That's amazing. Yep. And the goal here, when are we going to see hopefully more than just 6 languages? Is it just going to be language specific? I mean, it would be amazing if all the interpreters out there eventually got this training. And is it going to be in the future free as well?
Well, for the duration of the study, yes. So that's the first bit. The second bit is when we get to the implementation phase, which is next year, all of those linguistic requirements come off. The training is available for any interpreter in Victoria for free, but you won't get all those CPD points. All right?
Just get 20.
Yeah, then the points drop. So you get a lot this year and you get a little less next year. But it still remains free, but if you're in Victoria, which is nice because many of us are here. And that's part of the implementation phase. Eventually, what we want is to hand this training over to NAATI, because at the end of the day, if you're all interpreters, if you need to get trained on dementia, if you want to learn more about it, you want to upskill yourselves, you're not going to come to NARI, the National Aging Research Institute, necessarily to do it. Intuitively, you wouldn't think about that, but you would go to NAATI because that's your kind of professional association and body that you would look at. So we want to eventually work with them on this. What's really unique about this work is when we get to that implementation phase, like I said, because we don't have to do the assessments, any language. Your interpreters, you all speak English, so you can do the training in English, and you are then upskilled to facilitate that interaction in the languages that you interpret for. And the final thing I want to just say is that this is a world first study, so it's never been done before. So you're really the path breakers, the ground breakers, the innovators.
Pioneers.
You're the pioneers, yes, in this space. So it's a really, I think it's an exciting opportunity, but I hope you do too.
Yep.
Well, please, those of you watching at home and here, as soon as we finish this, go to the website, see if you're eligible and get in there. There's only 120 spots, and like we said, there's quite a lot of you out there. All right. So thank you very much for today again, Bianca and Andrew. I really appreciate it. And thank you for everyone coming here today in person. And thank you to everyone at home as well. And don't forget to like and subscribe, like we said. And keep an eye on future lectures, webcasts, and podcasts as well. Thank you very much, and we'll see you next time.